Well, good morning. I hope everyone who observed had a wonderful Easter with your family and friends. This is the second Easter we've had during the pandemic, and while we're still not out of the woods completely yet, it certainly was a more hopeful experience than last year. Dr. Harris and I are here today to update the people of Alabama on the progress we've made in reducing the spread of Covid-19, as well as to discuss the continuation of the vaccine distribution. As of Monday, the 7-day average for newly reported Covid-19 cases was 328 per day. That's a 92% drop from the high reached on January 10th and the lowest such average since the spring of 2020. Also on Monday, the 7-day average number of Covid-19 patients in hospitals was 331. That's an 89% drop from the highest reached on January the 11th and the lowest such average since the spring of 2020. Y'all, this is definitely good news, and we're definitely moving in the right direction. And again, I want to thank the people of Alabama for being so supportive and giving tremendous help to help us get where we are. On March 4th, I announced that we needed to get past Easter and allow more people to get their first dose of the vaccine before we lifted the mask altogether. However, I said that once we made it to April the 9th at 5 p.m., I would not keep the mask order in place. So today, I'm announcing that we are now entering into our, quote, safer apart health order that will expire on Wednesday, May 5th at 5 p.m. Folks, we're still under a public health order, but it is greatly slimmed down due to everyone doing their part to practice social distancing, wearing a mask, and voluntarily getting a vaccine. We know that wearing masks has been one of our greatest tools in combating the spread of the virus, and that, along with practicing good hygiene and social distancing, has helped us keep more people from getting sick or even worse, from dying. After Friday, when there's no more government mandate, I will continue to wear my mask and when I'm around others, and will strongly urge my fellow citizens to use common sense and also practical personal responsibility. After a year of having Dr. Harris and me stand up here extending the mandate, it's just the right thing to do to practice personal responsibility and make the choice to protect yourself and others. Many small businesses and large companies alike believe wearing masks are important to keep their doors open and their employees and customers safe. And over the last 5 weeks, they have come up with their own policies. That is their prerogative, and we should respect that. To be of assistance, my team and I also created signs that business owners could use to continue urging patrons to wear masks in their stores and restaurants. Those will be distributed to the media again today, and I ask that our friends in the press help circulate those to the public. They can also be found on the governor's website at governor.alabama.gov. As I said, I know other states have started to lift some of their restrictions, and we've been relaxing our restrictions throughout this entire ordeal, every chance we could. Just last week, I visited my hometown of Camden in Wilcox County to get a look at one of the drive-through vaccine sites that is being administered by the Alabama National Guard. Y'all, it's so encouraging to see that folks are wanting to get vaccinated and then to help themselves and keep their families safe. These sites are being operated all over rural Alabama, and I certainly appreciate the National Guard's teamwork to get shots in the rural parts of our state. Because of these efforts and the partnership with providers all across our state, almost 1.2 million individuals have had at least one shot of the vaccine. And folks, that's remarkable when you consider that there are around 5 million people in our state. That means almost 30% of the eligible people in our state have been vaccinated in the 4 months that the vaccines have been available. During our visit to Camden, we announced that anyone over 16 years of age is now eligible for the vaccine. We initially needed to limit supply to the most vulnerable populations, but as more supply is coming to our state, we can now expand eligibility so just about everyone who wants a shot can have a shot. So please continue to be patient as more vaccine arrives each week and our health professionals get more appointments scheduled each day. Now that a majority of the state is eligible for vaccinations, I imagine our phone lines and appointments will be in even greater demand. As Dr. Harris makes his way up to the microphone, I must once again thank the people of Alabama. You have certainly worked with us during this year, and we're finally rounding the corner. And while we haven't whipped this deadly disease just yet, it appears that, thank the good Lord, we're in the home stretch. So please, please continue to practice good common sense, and we'll see the end to COVID-19 soon. Dr. Harris.
Thank you. Good morning. Thank you very much. Governor Ivey, thank you very much for all you're doing to protect our state. We appreciate that so much. I just want to echo what Governor Ivey said. As the mask mandate comes to an end, we want to remind people to please continue to do those things that will protect people, protect yourself, protect those who are most vulnerable around you. We certainly trust the people of Alabama to exercise their own personal responsibility, to be aware of those who are at risk and to do those things they need to do to keep people safe. It's been, as everybody knows, a really difficult 13 months. We've lost over 10,000 Alabamians, about 10,600 Alabamians, and we're not out of the woods yet, and yet we do feel so much better about where we are now. I too would just like to acknowledge the sacrifices that everyone has put in. We're so grateful to the people in this state who have put up with so much and had to deal with so many disruptions. We've completely changed how we work and shop and worship and spend time with our family. So many things are so different now than they have ever been before, and yet people have really done their best to cooperate and try to take care of each other, and I do want to say thank you for that and acknowledge all those sacrifices that people have put in. We continue to roll out vaccines in the state, and we're very happy with how that is going. As we've said before, our first 2 or 3 weeks were slow, and that makes us low on these national rankings, but really for the past 3 months, Alabamians have done a great job. Our providers are really doing a wonderful job of getting the vaccine out and making that available. We have vaccines for the first time this week in more than 700 locations. We have multiple locations in every county. We know that it's still not as widely available as we would like. We still don't quite have the numbers of vaccine doses that we would like, but this week we've had more doses than we have ever had before, and we're very, very happy about that fact. We have done a terrific job in terms of our vaccine equity goals, that is, trying to get vaccinations to those people who are most at risk for serious disease. We know that we have many vulnerable people, particularly in rural areas, particularly in lower income areas, and Alabama's been credited nationally for their success in that. We're a top 10 state nationally in terms of reaching those populations, and that's due to a lot of great work by a lot of people. Again, I just want to say thank you to the Alabama National Guard. They've been tremendous partners. Adjutant General Gordon, Major General Martin have been wonderful partners for us. The guardsmen and women are working every day in our most vulnerable counties. They'll begin their second shot clinics starting over next week to go back through these 24 counties in the Black Belt and in the Wiregrass. They'll have the ability in most cases to give first shots again as well. Now that eligibility is expanded, if there are people who show up who need a first shot, they'll have the Johnson & Johnson vaccine available for people to get those first shots, in addition to those folks who are coming back for second shots. So we want to continue to reach as many people as possible. Just to remind you, as the governor said, everyone age 16 and up is now eligible, and I would encourage you to get the vaccine. I have gotten it, and my wife and my parents, and my kids are in the process of getting it, and my adult children and I would recommend that all of you get it as well. If you have questions about that, please talk to your doctor and ask those questions. That's the way that we get Alabama back to normal. So I do want to remind people that the vaccine is free. That seems to be a misconception that we hear about a lot. Even though providers might bill your insurance for an administration fee, they might ask you for insurance information. There are no costs to anyone who receives the shot. You will not be charged. All shots are provided free of charge. You will not have to pay for them. So please don't let that be a barrier for you. Please try to get a shot if you're able to do that. So finally, again, I would just remind people to please not let your guard down. We're so close to getting to the end of this. We still have a little ways to go, and we appreciate all the hard work that's gone on so far, and we know that working together, we're going to get there soon. Thank you very much.
Governor Ivey will open us up for a few questions now.
Yes, sir.
Governor Ivey, some cities instituting their own mask mandates and extending their mask mandates. Do you think that will cause an uproar or confusion among the public in those cities when it comes to the state mask mandate being rescinded? Are these cities extending their mask mandates?
Well, I certainly have no jurisdiction over the cities, but and businesses and other folks certainly have the right to set their own rules for doing business in their stores. So I just applaud the initiative of local people wanting to continue to encourage the mask. I'm certainly going to continue to encourage people to wear the mask whenever I'm out in a crowd or out in public. And one piece of good news is this CDC released some information recently that said right now it appears that people who've been vaccinated do not spread the virus. So that's another good example of why everybody needs to get vaccinated. But if you want to wear the mask, I certainly encourage you. And I certainly encourage the cities to as well. Yes, sir.
Governor, some of your Republican colleagues in other states, governors have issued orders preventing businesses from requiring employees to show proof of vaccination to return to work. Is that something that you would consider as we move forward in this process?
No, that's fun. I mean, every business is entitled to set their own requirements, but it's not going to be a requirement. Yes, sir.
Just a question for Dr. Harris. Several states have seen increases in their caseloads in recent weeks because of the COVID variants. I know that hasn't been the case yet in Alabama, but I'm wondering, are there any steps outside of just mass vaccination that you think the state could take to try to avoid what other states are experiencing?
Yeah, we certainly are monitoring that. We've identified a couple of hundred viral variants so far in the state of Alabama. Almost all of those so far have been the UK variant, and we know that the vaccine protects against that, and so that's somewhat comforting. But we are aware that those variants are spreading elsewhere. I think our strategy remains the same. I think that the same guidance that we've been trying to give people for a year now is the way to approach this. We hope people will try to avoid crowds, wear masks when you can't do that. Certainly do your best to get vaccinated as quickly as possible. That's the way that we're going to handle the variants and handle the pandemic.
A few more questions.
Kim?
Yes, ma'am. What restrictions are actually maintained in this order? I see a lot of encouragement on masks, et cetera, but what are the requirements and restrictions that will be in place?
From now to May 5?
Yes, ma'am.
Well, safer apart. So wear your mask as long as when you're out with people, and social distancing. Use common sense. Use personal responsibility.
That's an encouragement. Is there anything that is essentially an order of restriction other than the quarantines?
What remains in the order is still the health order about hospital visitation and nursing home visitation allowances. Those are still part of the order. The rest of it are encouragements for people to follow these public health measures, but not orders to do so.
So we're essentially under very few restrictions. It's shifting to personal responsibility and encouragement.
That's exactly right.
And a couple more questions.
Bethany?
Dr. Harris, we've seen this red light graphic here now for almost a year. Just like to get your personal feelings on how you feel about announcing we're finally at the green light, safer apart order.
I think we're very glad we finally reached this point. Yeah, you know, this past week is the first time we've been below a 5% test positivity rate ever since this began. We're very excited about that. These are the lowest number of hospitalizations that we've had since we had adequate testing, you know, since, you know, basically late April, mid-April or late April. So we feel very good about the situation we're in. That's not to say that we're, you know, not aware of what else is going on in the world. One thing we've learned about the virus is that we still don't know a lot about the virus. And so we have to be vigilant. We have to continue to do what we need to do to protect ourselves.
Yes, sir.
Governor, you hear a lot of people mention this phrase over and over again, herd immunity. At this stage of the game, is that still important, an important goal for Alabama to obtain that, to get people to understand what it means?
And to help people understand what?
What herd immunity means and why it's important to Alabama?
Well, herd immunity refers to, I think it's some 75% of the population being vaccinated. And like I say, CDC put out that information that said people who've been vaccinated do not spread the virus. So it's just a measure that we shoot for to encourage people to get vaccinated, as many as will and many as want to.
And a couple more questions?
Yes, sir.
Governor, can you give us the latest? Do you plan to sign Representative Kill's bill that's designed to keep churches and businesses open during a pandemic like this or another health emergency?
I think I've already signed that bill, and I was happy to do so, and he's codified what we learned and agreed to, and I was happy to sign the bill.
All right, and last question before we wrap up. Brandon.
Many churches and businesses are eager to get back to full capacity. Is it too early for a church to, for example, go from 50% capacity to 100% capacity, or businesses? What is your state's recommendation?
I think I would refer to the respective pastoral minister of that church and use their own common sense. We're giving people time to make the adjustments as they need to. I continue to attend church services live streaming on Sunday mornings, and but I look forward to getting back into church.
All right, thank you all. That's all the time